Hello, I'm Tasa Richardson, and I would like to be the first to welcome you to the Midland Health Podcast, healthcare that makes you proud. I also have the honor and privilege of introducing Stephen Bowerman. He's our president and CEO at Midland Health. He's going to be the host of the show. We're going to go through a little bit today, give you a good foundation, and set you up for a good series. Steve, welcome.
Thank you, Tasa. Thanks for helping me get this off the ground. We've been talking about this for over a year.
I'm so excited to
Yeah.
do this. Let's start everybody off by telling a little bit about
Yeah.
yourself.
Yeah. You introduced me. My name's Stephen Bowerman. I'm the president and CEO for Midland Health. If you're familiar with my story, I'm a West Texas guy. I'm originally from Kermit, Texas, small town about an hour west of here. We are the Yellow Jackets, not the Frogs. Please get that right. But grew up in Kermit. Went to college at West Texas State University. It was state when I started, so I still reference it as West Texas State. I'm a Buffalo, not an Aggie. Graduated in 1999. I moved back to Midland in August and started my career in healthcare. Really wasn't looking for a career in healthcare. I moved back here and was looking for a job, and I ended up applying for a position in the information technology department at Medical Center Hospital in Odessa. Started there in October of '99. Drove back and forth every day, lived in Midland for that entire time, but was there for about 6 years, leaving the IT department after a couple of years and moving into the accounting department for a little over 4 more years. And then in 2006, I moved over to Odessa Regional Medical Center, originally Odessa Regional Hospital, as the controller. So I was leading the accounting department there. I'd been there maybe 6 months, and Odessa Regional acquired Alliance Hospital, which was right across the street. Putting those two together is what made that into Odessa Regional Medical Center. So I spent the next 2.5 years helping the team kind of pull those organizations together as one hospital. And then met with Russell Myers, my predecessor and one of my mentors, late in 2008 about coming over to Midland Memorial as the chief financial officer. Um, Whenever we had acquired the Odessa Regional Hospital, acquired Alliance Hospital, I was promoted from controller to CFO. So I spent that last 2.5 years. That was my initiation into the executive suite, and then came to Midland Memorial in February of '09 as the chief financial officer and worked in that role under Russell and our boards for the next 14-ish years, and was named president and CEO in April of 2003, and I've been in that role for almost 3 years now. So Midland and West Texas are really home to me. I have tell everybody I really have no desire to go anywhere else. I love the people here, love the community. I'm married to my wife Monica for almost 25 years. She's my high school sweetheart. We've raised both of our kids here in Midland. They both are LHS graduates. Dylan's now a senior at Texas Tech University, and Jack is a senior at LHS, about to start his wrap up his first semester before he graduates, and will be empty nesting in this time next year. So that's kind of a short summary of my path in healthcare and how I got into this role, and kind of what I do for the hospital today.
I've heard your story several times now, but I always love to hear like the roots that you have here in West Texas and that you're still so proud to call this home and contribute. But one thing, I mean, I have to know, like, I'm also a Buffalo. So we come back, that's probably my best favorite thing from your history.
Yep, yep. We're another West Texas state grad. It is West Texas A&M now, but I did go back and get my master's at Texas Tech University. I'd been working. It was actually when I started at Midland Memorial, so I'm a proud Red Raider now, and we're about to enter the playoffs, and exciting time for Texas Tech.
It is,
Yeah.
absolutely. All right, today's a pretty exciting day. I mean, the launch of this podcast is something I've been looking forward to for a while here, but tell us a little bit about the why. Why are we doing this?
Yeah, good question. There's just been so much discussion in the community, and we've recently did a large fundraiser, our campaign for tomorrow, 2025. That's hitting on a lot of the construction projects we're doing now, which I know we're going to get into a little bit later. But a lot of the feedback I got from new people that were introduced to our foundation or contributed to the project, when they heard our presentation, a lot of the very common themes in the feedback I got was, I had no idea that Midland Memorial did all this. Like, I've been to the ER once, or My wife and I, we had our 2 kids here, but we've never been in the hospital otherwise. We thought you were just a hospital. We thought that we didn't know that you had all these capabilities. I was meeting with a physician just a couple of weeks ago, and he was getting he was in I'll say a metropolitan area in the state getting training on some new technology that we were acquiring for procedures in our operating room. And he told me, he's really honest. He said they had their in their name of the hospital. I won't say the name of the hospital, but it was a robotic hospital, and that's where he got this training for this new technology. And he said he thought, I'm going to go in here, and I'm really excited to see what kind of technology they have. It's a robotic hospital. And he said he went in and he said, we Midland Memorial has way more stuff than they have at this really specialized robotic hospital. I know in future podcasts and a little bit today we'll cover some of those things, but we have 3 Da Vinci robots. Just today, our board approved the purchase of our third one. A lot of hospitals don't have any; some have one. We have 2 Mako robots, which are used in orthopedic cases. We have a robotic and navigation system for neurosurgery cases. We have a lot of really advanced technology. And when I talk about this with people, they're like, I had no idea. When I heard from this physician, that was his point is, what are we doing to tell the community about all the capabilities we have? Because nobody thinks about the hospital till you need it. And then at that time, you don't know what capabilities we have. You don't know what kind of physicians we have, what kind of technology we have. So we thought, what's the latest fad is podcasts. So let's find a way to create some short episodes and have some topics that cover the capabilities of our organization, so that maybe people do have some confidence when they have a need that they can come to our hospital and get good care. And as the tagline says, we want you to recognize that we provide healthcare that you can all be proud of. These podcasts are going to be available on YouTube if you want to look at us, but if you're driving to work and you're looking for something to listen to for 20 or 25 minutes, I think they're going to be available on Apple Podcasts, Spotify, pretty much anywhere you can get access to podcasts. So we're really excited to kick this off today and really talk a little bit about Midland Health from a broad perspective, what the organization is. And then in future episodes, we're going to talk about service lines and capabilities and technology and things that you could expect if you come to Midland Memorial for care.
Sounds exciting. Looking forward to it. All right. I mean, you laid out the foundation there. Let's just discuss a little bit more about the organization itself. I mean, I we're celebrating 75 years of service this year, so we have a long history. Take us through that history and how we got to where we are today.
Yeah, it's a really impressive story to listen to. I heard a lot about it in my time here. And it's really inspiring to hear about how our hospital started and how it got to where it is today. But as you said, we opened our doors on July 9th, I believe, 1950. We've seen countering
Mhm.
dates, the 9th or the 11th, but in July of 1950, the hospital opened their doors. And that was the hospital was built with solely with private donations from the community. And the Midland Memorial Foundation was formed. It was formed before 1950 to raise the money to build the hospital, and the hospital opened its doors, as we said, in 1950. When it opened in 1950, it had 78 employees, and it was about 58,000 square feet of space for the hospital. And Midland County at that time, the population of Midland County in 1950 was 21,713.
Wow.
So that was 1950 when we opened the doors. Obviously, we've had lots of projects and expansions to Midland Memorial throughout this last 75 years, multiple expansions that have occurred. But the next really key inflection point for our organization was in 1978. There was an election that was held. I wasn't here in 1978, but the stories that I've heard is there was a need to raise some additional capital for another expansion. And so the decision was made to hold an election to form what's called a hospital district. So we're a political subdivision of the state of Texas. And that election was held and won very significant by a significant margin. The community was very supportive of setting up the hospital district, and that allowed the hospital district to assess a property tax, ad valorem taxes, like the city, the county, or the school district. We're a political subdivision like that. That election happened. The foundation that raised all the money for the assets through those first 28 years basically gave all the assets that they had generated to the district to start the district. And so now all the hospital, all the operations that happen in the hospital really fall under the umbrella that starts with the Midland County Hospital District. Lucky for us, our Midland Memorial Foundation is still very involved. They fundraise for us all the time. We have a number of endowments that we have that support the emergency room or the lab or pharmacy or nursing education. We have so much support that still comes in from the community and foundations that we have in the community that we're able to keep our tax rate very low relative to other hospital districts across the state. And that's a unique model for a hospital like us to have that kind of foundation support. And they're still very involved with governing the hospital.
I mean, let's talk a little bit about that. I find it very impressive the amount of community support and philanthropic generosity in our community and how we are, it's been a big milestone in where we are today. Like what there's lots of foundations out there, there's lots of generous support. I mean, what does it mean to you to have a community behind you with that philanthropy
Yeah,
spirit?
we're blessed. The community has a philanthropic spirit. I think per capita, it's probably comparative to any community in the country when you think about what we've been able to raise. So it's inspiring. It's humbling to have that kind of support. But I also tell the team with that support comes expectations. They don't give that money and they don't give that support to get the same old care they got yesterday. Whenever we do these kind of projects, when we invest in new technology, they expect us to up our game and be able to do more than we did yesterday. And so that's an important note for us. While it is inspiring and it is humbling to get that kind of support, it demands that we do more when we get that kind of support. And I think you look back over that 75-year history, and we'll talk a little bit about size and scope. What we've been able to do over that 75 years, we've grown our capabilities dramatically. I referenced the size of Midland and the number of employees today, as we were celebrating our 75th year, today our facility has about 750,000 square feet as compared to that 58,000 square feet when we opened in 1950. We have 2,566 employees as compared with the 78 employees that we had when we opened in 1950. And the population of Midland County is now 100, over 177,000 people compared to the 21,000 people that we had
And
in
still growing.
1950 and still growing. And of course, we know that Midland is somewhat of a transient population. There are people that come in here that work here all week that get health care in Midland, but they may live somewhere else. Those people aren't even in the count. So the dependence that our community and the region really have on Midland Memorial Hospital is greater than it's ever been.
Let's transition. The mission of the hospital is leading healthcare for Greater Midland. What should that mean for our community?
Well, I think when you have mission, vision, and value statements, they can mean a lot of different things to a lot of people, and I think that's the purpose of those. There's somewhat an art to that, and I think art can be construed by the person that's hearing it. But for me, and certainly the message that I give to our employees and our team is to begin with, leading is the first word of that, and so that means that we want to set the bar for healthcare in the Permian Basin. We want to invest in new technology. We want to be leaders in advancing healthcare that we provide. So that leading healthcare, that means we want to be leaders in that. We may not be on the bleeding edge, is what I always say. I don't want to be the trial and error location, but when something's been proven, there's evidence based medicine that supports that. Whether it's the hospital and our operational revenue that we have, or support from foundations, or our Midland Memorial Foundation, or from the taxpayers, that we go and invest in that technology so that we can lead that care that's happening in the Permian Basin. And then, as I've said, the leading healthcare in Greater Midland. Greater is an important word in that mission statement. We redeveloped our mission, vision, and values about 11 years ago. I think it was 2014, and that was really the first time that we, I think, agreed with the board to represent ourselves as more than just a hospital for the community of Midland. I think prior to that point, even though patients came from all over the region, we were Midland Memorial Hospital. We were here for the Midland community, and that's what we did. But we've recognized over time the dependence that the surrounding rural communities have on us. They all have, a lot of them have hospitals and healthcare capabilities in their small communities, but they probably don't have the capabilities, all the capabilities that we have at Midland Health. So that greater Midland really represents that we're here not just to support the citizens of Midland, but the patients across the Permian Basin that expect higher levels of care from us than they can get in their communities.
Absolutely. This next conversation that I want to go into is something I don't think that people really fully understand the scope of Midland Health. What all does it entail? Like, are you just a hospital?
Yeah. For a long time, that's what we were. Midland Memorial Hospital was our name, and that's all we pretty much were. We were the hospital in town, and while there were other healthcare organizations all around the community, we took care of the hospital, and they took care of themselves. But healthcare has changed over the last certainly the last 20 to 25 years that I've been working in healthcare, and that there's a continuum. There's a relationship between your primary care doctor, the specialists that you might see in cardiology or orthopedics, to the hospital, to what happens when you leave the hospital, whether you're getting physical therapy on an outpatient basis, you need lab tests done regularly. You might need post acute care. You might go to Encompass, the rehab hospital here in town. You might have mental health needs. You might have substance abuse needs that you need to address. While all those things don't happen inside the walls of Midland Memorial Hospital, we're very entrenched in all those levels of care. Some things we own and operate, some things we function with partnerships. Sometimes we have contractual relationships and we're involved with those things. So there's a number of things that happen. If you think about the org chart that we're going to flash up on the screen for you just for a reference, Midland County Hospital District is kind of at the top of that. That is the entity now that all these things fall under. The Midland Memorial Foundation, while it's its own entity, is certainly connected to that. The hospital district is the only beneficiary that exists for Midland Memorial Foundation. They may give funds to other organizations, but it's only if they advance the mission of Midland Memorial Hospital. We also have our auxiliary. We would not be where we are today without our auxiliary. They've been in place since 1950 when the hospital originally opened, and they provide a great level of patient experience support to patients and visitors at the hospital. They also operate our gift shop, so they've got snacks and treats and gifts that you can give if you're having a baby or if you need to go see somebody that's not well. And all the money that they generate through the work that they do comes back to the hospital. They just gave a $500,000 gift to the hospital for our campaign for tomorrow, which the project that we're going to talk about a little bit later. So those are really important components of the hospital. But below that, we've got 7 nursing homes that Midland County Hospital District owns the license for. We don't operate any of those nursing homes. We have partners that operate those, but most of them are in Midland. But we also have a nursing home in Odessa. We have one in Monahans, and we have one in Fort Stockton. We partner in those. We hold the license and hire an operator because if a nursing home has a public entity that's a partner, like Midland County Hospital District, they can get enhanced reimbursement for quality work that they do. So we partner with these operating entities to make sure we're pulling as much uh, revenue funds, whether it's from Medicare or Medicaid, to make sure we're delivering high quality care in those nursing homes. And so we're proud to partner on those 7 nursing homes that we have. Um, we also have Midland Memorial Incorporated. Because we are a political subdivision of the state of Texas, we can't really have joint ventures per se. So Midland Memorial Incorporated is a taxable nonprofit that was created under the Midland County Hospital District umbrella that holds a lot of those partnerships. So some of the things that we do that you may not know about and may not need to know, but it's interesting to cover these things, is the Texas Healthcare Linen. That is a linen company that its operation is in Abilene, Texas, but it's owned and operated by 4 hospitals in West Texas: Midland Memorial, Medical Center Hospital in Odessa, Texas, Hendrick Hospital, which is located in Abilene, and Shannon Health, which is located in San Angelo. The 4 of us own that linen company, and we pretty much do all the laundry work for any healthcare entity across West Texas, from Lubbock down to the Valley, all the way down to San Angelo and Abilene, to Midland, Odessa, and pretty much everything in between. We started that after I got here in 2010. We outsourced our laundry work. We constantly got complaints from patients about the quality of that, holes in their washcloths, little bitty towels that were pretty threadbare. And so we were unhappy with what we were getting there. And so we started having conversations with these other hospitals that some people outsourced, some people had their own internal laundry. and we wanted to create a state-of-the-art laundry facility to take care of that, and we've seen an improvement of the quality of care that we provide when it comes to the linens, that happen in the hospital. We talked about Encompass Rehab Hospital. We have a partnership with them. We own 18% of that operation, along with Medical Center Hospital. They operate the facility, Encompass fully responsible for the operations there, but they're a great partner. They're a really important partner in that continuum of care that we talked about. When you need post-acute care, there may be a chance if you're after a heart care or maybe a stroke that you may need some time in Encompass. And so having us as a part of the ownership structure there and part of that board helps kind of guide the healthcare that's happening there. And so we've got our fingers in that to make sure high quality care is provided. Encompass is a great provider and we're proud to be their partner, but that's another example of partnerships that we have under that Midland Memorial Incorporated heading. We also own and operate the two surgery centers that are here, both Texas Surgical Center and Choice Care Surgery Center, which is the newest one. We have a joint venture partnership with a company called United Surgical Partners International. They are an entity owned by Tenet Healthcare, and they own and operate surgery centers across the state of Texas and across the country. Their model is to partner with the community hospital to do these surgery centers. So that joint venture with USPI owns 51% of the Texas Surgical Center and 51% of Choice Care Surgery Center. The physicians that originally started those are still partners in there. So we have medical staff leadership. We also have operational leadership from USPI, and we operate those things together, and they're very successful. It's a really important access point that I think communities expect now. It's a little cheaper for some cases to be done in the surgery center. It's not as busy and complex as the hospital to navigate. There's so many services. If you need a specific surgery and your physician wants to do work there, they can tell you drive up, you go in the front door. It's a small setting. You get your surgery and you go home. And you don't have to come to the hospital. So both of those provide great care in the community, and we're happy to be a part of that. And then lastly, we have Midland Health at Home, which is a home health agency that we own 40% of and operates and provides care at the home for patients that need it. You may not need to go to Encompass. You may not need to go to a skilled nursing facility at one of the nursing homes, but you may still need some help in your home while you're recovering from something. And Midland Health at Home is available to do that.
That's a lot.
That's a lot, and that's not all. There's
No,
more. Yeah, there's a lot more. We're a very complex organization. We have a couple of service line partnerships in radiology, where we have a partnership on all of our outpatient imaging work that we do with a group of local radiologists. That is a huge benefit to the community. They may not realize it. You often don't ever see your radiologist, but the fact that your primary care provider that may order an MRI at the hospital is read by a doctor that lives here, and they can call and, hey, I got your report. I want to talk to you about what you saw on this scan is really valuable. A lot of providers, if you go to a freestanding imaging center, pretty much those things are sent out via images to somebody that lives somewhere else, maybe outside the country, who reviews those scans and gives the report. It's really valuable for us to have local radiologists that do that work. They live here. They have relationships with the providers that order those tests, and I think it ups the level of care that we provide here. We also have a partnership with West Texas Therapy. They provide speech, occupational, and physical therapy out at the Legends Park office building. They're a really busy entity that was independent 15 years ago, but that we acquired, and we have a partnership with three physical therapists that really operate that facility for us under the hospital umbrella. But we depend on them a lot to make sure that service line runs well. And the latest partnership that we have that's not really open yet, but it is really a big addition to that organizational structure that we have, is the Permian Basin Behavioral Health Center. That is a partnership with Medical Center Hospital that's located out just north of the airport on 1788. We plan for that facility to open in the second quarter of 2026, maybe open by the time you hear this podcast. But we're really excited. That's a 200-bed mental health facility that'll service not just Midland and Odessa, but again, the entire Permian Basin. Recognizes that leading healthcare for Greater Midland. It's not just for us; it's for the entire Permian Basin. That was funded pretty much solely with two sources of funds. The state, Speaker Craddock worked very hard to get funds for this organization, over $125 million that came in to build that. And then we've raised about $100 million privately through foundations and individual donors that have given to that project over the last couple of years so that we can get that built, open, and operational in the second quarter of 2026. They'll have a crisis intervention unit on site. So if somebody is really having an issue at that time, they can present there as opposed to our ER. You can certainly still present to the Midland Memorial Emergency Room, and we'll get you out there. And then there's going to be a number of outpatient services that are provided with our medical partnership with Texas Tech's psych program to provide outpatient services. So hopefully people can avoid the need for inpatient beds, just like we experience on the hospital side. And then lastly, we have a number of physician organizations that we partner with. Texas has what's known as a prohibition against the corporate practice of medicine. There's only a few states that still have that. So doctors are not allowed to work directly for the hospital. But we have other entities that we've set up that the hospitals work, the physicians work in. They have their own physician board, but the hospital is the sole member of that organization, and it allows us to provide financial support to these organizations. We have Premier Family Care, which is known as Premier Physicians, that primarily employs the primary care providers in the community. So if you think about family medicine, internal medicine, a lot of the providers in town are employed with Premier Physicians, but we have other specialties that are in there: neurology, cardiothoracic surgery. The only two cardiothoracic surgeons in the region are employed by Premier Physicians, and they cover all the hospitals in the region that need or provide open heart surgery. So there's a number of specialties that are in that organization. We also employ Permian Cardiology, which is the long-standing cardiology group in town. They office on the second floor of the Craddock office building. Those are employees and partners of ours. We have West Texas Orthopedics, which offices on the second floor of the Legends Park office building out by the stadium. They provide a lot of the orthopedic care that happens in our hospital and in the community. And then we have MMH physicians or Midland Inpatient Management Associates. Those are the physicians that when you get admitted to the hospital, they take care of you while you're in the hospital. They don't have a clinic setting that you go see them after you get discharged from the hospital. They're specialists in providing care while you're in the hospital. They take care of you there and then hand you back off to your primary care provider. And then lastly, we have our Midland Quality Alliance, which is made up of a lot of our employed physicians, but also physicians that are independent providers, and we work together to find ways to improve the quality of care, coordinate care better across all those specialties, and make sure that our patients are getting the very best that they can. So all that kind of falls under the Midland Health umbrella. Midland Health isn't an entity that actually exists, but it's used to reference all those things that we just covered.
Like a health system.
It is a health system. It is. We have one hospital, but there's a lot of other things that happen under there, and we'll have another hospital that gets added under that umbrella when the Permian Basin Behavioral Health Center
I
opens.
kind of like to think of it as a pie. Like this org chart is a pie, but you as the patient of Midland Health, we are charged with looking at everything that you're going to need in your pie to complete your healthcare. You don't know that you're going to need a cardiologist today, but we have to think ahead and think that we can provide all of the healthcare services for our community.
That's right. We want to be comprehensive in the care that we provide in that continuum. I'll reference a lot. It's all those things that happen before you come to the hospital and after you leave the hospital. We want to make sure that we provide everything we can in that continuum so that when you need it, it's here and ready for you.
I think you laid a good foundation for us. Let's move on to some current events. If somebody were to drive down Illinois right now or Andrews Highway, they're probably seeing a lot going on at the hospital and our main campus. We're currently executing our phase 2 of our master facility plan, which means we've completed phase 1 and there's a phase 3. So tell us a little bit about that.
Yeah, we're really excited about this. This kicked off in February of 2023. The total project cost is about $157 million. So if you think back about 15 years to the Scarborough Patient Tower, that was a $175 million project. So this is another, just 15 years later, we're investing over $150 million into the community. But there's a number of things that are happening there. I'll kind of hit the high points. Phase one, which has already been completed, was really a revamp of the F. Marie Hall Outpatient Center, which is the name of what we used to call our West Campus. That used to be a full service hospital, primarily focused on women's and children's services. But when we opened the Scarborough Tower in 2012, we consolidated all of our inpatient work to the main campus. So what we've done is moved things out of the main or hospital that are not necessary to be on the hospital campus. Back office stuff like the billing office and the accounting office and materials management have relocated to the F. Marie Hall Outpatient Center. We had to redo the roof there. We had a major hailstorm that came through about 5 years ago that we had to replace the roof. We replaced a lot of the facade. We added additional parking on the north side of the campus. We've updated the lighting out there. We've invested a lot. That was the primary component of that phase one, is to relocate people out of the main facility that don't need to be there. That frees up space for additional healthcare services on the main campus. So that took us into phase two, which we're getting close to wrapping up now. There's a lot of things that are happening there, but if you've been down to Illinois, the most obvious thing that's happening is the new 4-story office building that's opening just east of the hospital campus, east of the Texas Tech Laura Bush Institute. It's a 4-story, 100,000 square foot office building that'll house some hospital departments. What we're trying to accomplish on the first floor of that facility is to create an access point for patients so they don't have to enter the main complex part of the hospital for things like medical records. We'll also have our HR department on the first floor there. So if you're needing, we are certainly in search for additional workforce. If we're trying to get employees, we want to make it really easy for them to get in, apply for a job, get information they need, and get out. So that's what'll primarily be on the first floor of that first floor of the office building is hospital departments that service things that are not really critical to the main healthcare that's being provided there. So it'll provide that drive in and drive out access. It's about 2/3 occupied as we're building it out today. We left a lot of shelled space in there for future growth, and we already have physicians that are talking to us about moving into that office that want to be on the hospital campus. It's really valuable for them. We also are adding the MCHS OB clinic. Right now, they're officed in the old part of the hospital, what used to be the old hospice unit right above my office. We'll talk about why it's important for them to move out, but they need a new location for their clinic, and so they'll move into the office building when that opens early next year, and it'll be a brand new clinic that's built for OB patients. Like I said, they're right now operating out of what used to be a hospice unit. It's not a unit that's built for OB care, so hopefully, it really dignifies the work for the patients that go in there, but the work that the staff in the MCHSOB clinic are doing. And so we're excited to get them moved into there as well. Some of the other things that are happening is if you've been in the hospital, we have a couple of large patio areas that we're building out. We're trying to make utility of all the space on the main campus that we have to minimize the need for a 5 or 6 story office building. So a lot of that's getting built out. There's expansions for radiology, the medical staff offices, administrations having to move. We have 2 shelled operating rooms that we're building out. So on the third floor, where most of the operating work happens, there's 10 ORs today. In just a few months, we'll have 12 operating rooms. So it's about a 20% capacity increase because we're doing a lot more surgeries today than we were even 5 years ago. We're recruiting new physicians and we need that space. Um, we also are moving what we have a what you might call a retail pharmacy today that's located in the Abel Hanger Pavilion just south of the hospital. Today, that pharmacy only provides scripts for employees, people that are on the hospital's health plan and their dependents, and indigent patients, people that qualify for the financial assistance program that we provide at Midland County Hospital District. We're moving that pharmacy over to the main campus, and it'll still do the work that I just described, but we're also excited to kick off a meds to beds program. So, what we'll be able to do is make sure when people are getting discharged from the hospital, either from an inpatient floor or from the ER, if they need it, they can get their scripts before they leave. The most common reason people get readmitted to the hospital is because they didn't get their script. I've had kids at home, little kids, and my wife, and one of us in the hospital trying to get to HEB or Walgreens or Walmart to get a script filled after you leave the hospital. it's stressful. It's very stressful. You're trying to figure out how to get back to work and handle your kids. So this service is going to make sure people leave with their scripts.
And that's key because there's sometimes you get discharged not when the pharmacies are open.
That's right. That's right. And we'll be open normal business hours 8 to 5, but we also have a lockbox set up. So if it's after hours, there's always a pharmacist there. They can put your script in the lockbox, text you that code, and you can swing by right outside the dining room and pick up your script. There's a phone that's there with a monitor. So if you need to talk to a pharmacist, if you have a couple of questions about your script, you can pick up that phone and somebody will be there live to answer you 24/7 about your scripts. That's a huge addition for the community. We're really excited to be able to offer that service. It's important for the hospital too. We don't want people to be readmitted to the hospital, and we've identified that as the best way to make sure that doesn't happen. So with them moving out of the Abel Hanger Pavilion, we're redoing that. You may have seen that as well. We're reskinning that, putting in some windows, really trying to improve the setting there. And on the first floor, we're going to relocate our infusion services department. So people that need outpatient infusions for chronic health diseases, or any number, if you may need an antibiotic for 6 weeks. Long time ago, you stayed in the hospital for 6 weeks and you got your infusion every day. Now you can go home, go on with your life, come to the infusion department every day, week, month, whatever the requirement is for that infusion, get your infusion and then go back about your life. That'll all happen on the first floor. We'll maintain an MRI in that setting. That's one of 4 MRIs that we have in the community. That'll still be there. And then on the second floor, really excited about this as well. It's a simulation center that we're opening. So as we try to compete for workforce and have people that are interested in joining healthcare, we thought it was really important that we have a simulation center. Healthcare is fast changing and evolving, and we want to make sure we have a place to teach not just new hires, but you could be a nurse or a surgical tech for 10 years. New technology comes along. How do we teach them to use this? Having that simulation center will really advance the care that we think we provide, and it'll generate probably the best workforce in West Texas having that available. We'll have an operating room in the simulation center. We'll have an L&D room. We'll have a ER room, a trauma room, med surge, critical care. Basically, every setting that we have in the hospital will be built out in that simulation center with the same kind of equipment that they have in the hospital. So when they train on infusion pumps or they train on the computer system, all that stuff will be mirrored. So whenever they learn in the simulation center and then they go to the active environment to take care of real patients, it's all a very familiar setting for them. So we're excited to get that up and operational, and we think it'll make a difference for workforce.
Absolutely. To have that resource there for our staff, I mean, the trickle down effect to the quality of care that the patient will receive because they have that training right here is just, I can't wait
Yeah.
for that.
I'm excited. That's a really big get for us. And back to that mission of leading healthcare for Greater Midland, we've talked to some of the rural hospitals. We want to make sure that we make that available to some of our friends. They may not have access to those kind of tools. So we have 3 different simulation specialists that are employed by the hospital, so they can set up simulations for things they may see in Stanton or Monahans, and then they may set up different simulations for things that we'll see at Midland Memorial. It's going to be a really busy simulation center, but we're excited to offer it. We want to be a good partner. We want to lead healthcare for Greater Midlands. That's one way we can do that.
Absolutely. So we've grown structurally so much since 1950, and as you said, we're continuing to grow structurally. But not only have our walls and structures changed, but we've changed with our services and programs and technology that we provide to our community and the quality of care. You could probably talk about all those things for hours. But what are the things that really stand out to you most?
Yeah, there are a lot of things, and we are going to talk about it for hours. Not today, but that's kind of the purpose of this podcast is to bring in different guests as I move into the host role, and have them talk about our capabilities and the technology that we have. But there's a few things that are obvious to hit on. I talked about our 3 Da Vinci robots that we have. That's unrivaled anywhere in West Texas, but we're acquiring our third one by the end of this year. Our board, as I said, just approved that. That's minimally invasive surgery. Those robots allow shorter times in the operating room, faster recovery. We have much better outcomes on cases that use the robot. Sometimes the robot can't be used, but we're doing 900 cases a year on the robots now. We need that third robot to be able to continue to expand on what we do. It's a really important technology to have when you're trying to recruit new physicians. All these residents that are in medical school today, they're training on these type of tools. And so when they're graduating and they're trying to determine where they want to go and practice, it's important that you have these things. So they say, hey, I learned on the Da Vinci robot. I don't want to go anywhere where I can't use that kind of technology because I know it provides the best outcomes. I want to have that. We have two Mako robots that's used in the orthopedic service line. Makes all of our orthopedic total joint procedures go much faster, have higher performance in their outcomes. We have two of them because our guys are so fast. They'll go from one room and then they'll go to the next room while we're closing in one room. They have that second Mako robot. And we did over 2,900 orthopedic cases in fiscal year 2025. So those two Mako robots are really important. Also mentioned that we have the navigation and robot for our neurosurgery cases that we have. And you think about that, that's cases on the brain. If I ever have to have that done, I want it to be as precise as possible. So that's something a lot of facilities don't have those kind of systems, and we're proud to have them. We also have great technology and imaging. I talked about the great relationship we have with our radiologist. We have 4 MRIs in the community. I had somebody tell me just the other day, again, these are the things that I hear that make me think, how do we tell this message? They were waiting for an MRI. Their mother was in a facility in Dallas. Again, I won't say the name of the facility. I don't want to throw anybody under the bus. But they're like, hey, we're waiting for my mom's MRI. What's the status? Well, she's in the queue. We only have one MRI in our facility, and so she's in the queue. They run that thing 24/7, and you might have to wait a day before you get it. We have 4 MRIs in our community. We also have a PET CT that's important for cancer treatment and some other things that we do in urology and other specialties. We've had that for a couple of years now, but I know when we got it, it was one of the first 10 that were introduced into the United States. We were one of the first organizations to acquire that new technology. So we have a lot of good work there. We have 2 mammo machines that provide 3D imaging for the breast. Again, a lot of people don't have that level of technology yet. I met with our radiologist just a month ago, and they're saying we may need a third mammo machine. We're seeing our community grow. They're getting younger, and we probably need to add another one of those in the future. But really excited about all that technology we have, adding the 2 additional operating rooms, what we're doing in the pharmacy. There's just any number of things, and we'll hit on a lot of those things. I don't want to steal everybody's thunder, but we're going to talk about heart care. We're going to talk about orthopedic care. We're going to talk about different service lines that we have, what kind of physicians we have, what kind of cases we do, and what kind of technology we have. But we certainly have technology in our organization that everybody can be proud of.
Absolutely. And we can only scratch the surface today. So I'm very excited to hear and dig a little
Yeah.
deeper throughout this podcast, month after month to learn more. And I'm sure even over time, more stuff will come on, even that's not here today that you've already talked about. So
Yeah, we plan to do this podcast all of 2026. We'll have a monthly release that we're going to do, and we don't have all of the subject matters filled in. We've got a lot of ideas and a lot of people that are jockeying for, hey, I need to tell my story. That's what our service line leaders do. They're like, my service line's really important. I want to talk about it. We've got physicians that want to come and talk about it. So we're trying to prioritize and sequence these in a way that makes sense for the community and makes sense for the story. But we're really excited to kick this off and have some guests that can come and talk about it. Try to keep it, as I always tell my team, can you talk about this at a third grade level? Like this isn't a conversation that's going to happen between nurses and between physicians. This is meant to provide information to the community. And as I said, nobody thinks about the hospital until they really have a need. And so we're trying to provide this as information that can drive some confidence. So hey, if you ever need healthcare, you know that we have it, and again, provide healthcare that you can be proud of. It makes me think of our biggest benefactor and champion over the last certainly the 15, 17 years that I've been at Midland Memorial, Rosalind Redfern Grover, who passed away just recently. A very sad loss, not just for Midland Memorial, but for the entire community. But her tagline, which I use all the time because it really was inspiring to me, and when I say it, it still makes the hair on my neck stand up. But she would tell people, if you have cancer and you need treatment, you can make the choice to go to MD Anderson. If you need a certain other kind of specialized treatment, you can make the choice to go to Dallas and some special hospital there. But if your husband has a heart attack, your wife has a stroke, your child's in a car accident, they're coming to Midland Memorial. And how good do you want us to be? I can tell you for all of our staff, our medical staff, all of our providers, we want to be a facility that you can be proud of. And we work every day to advance our technology and our capabilities and our competencies and recruit new physicians and train our staff up so that we're ready whenever you have that need, when you have that emergent need and you have no choice on where you go, when you come to Midland Memorial, that you have confidence in the care that you're going to get when you're there, and when you leave, you're really proud of your local hospital. That's the purpose of this podcast. That's why we wanted to kick it off. We want to make sure this messaging is out there. Be transparent about the things we're trying to work on. Get our story out there and control the narrative so people has this information, so you don't have to go searching for it when you find yourself in need.
Absolutely. And I think a great transition to wrap us up here today is circling back to the slogan of this podcast, healthcare that makes you proud. When I think of that, I get to walk through these doors every day, but I see and hear the stories of care provided and kindness and life-saving procedures and compassion and even miracles happen in our walls, and I'm proud and honored to get to work for this organization, but even more than that, the confidence it gives me to know that if my family needs healthcare services, that they're in great hands. What does it mean to you?
No, I think you hit it. You stole my thunder. That tells the story. It's really easy for me to get up here and say you can trust us and come for us for care, but like this is where I bring my parents. Like if something happened to them, my son dislocated his knee in a little basketball accident. I took him straight to one of our orthopedic providers. I didn't go to Dallas. Would never dream of going to Dallas. I know what those capabilities are. So it's not just a pitch for me that you should have confidence in us. I live it every day. The advantage I have is I live it, I work it every day. I'm in the organization every day, and so I have confidence. I have every reason to have confidence because I have knowledge. You may not have knowledge. You may say, I don't need the hospital. I'm healthy. But that moment that you do, I think it's a natural thing to think I should probably go somewhere else. It's probably better somewhere else. In a lot of cases, it's not. It's not better. You're going to get the same level of care here that you would get anywhere else. We have the people, we have the physicians, we have the technology that you can count on. So you hit it. That's what I would tell people. If it was my dad, this is what I would do. If it was my son, this is what I would do. And for most things, I would stay right here in this community because we do offer healthcare that can make you proud, and you can have a lot of confidence in the care that we provide. So, as we go through this podcast series, we hope that we can continue to build on confidence and find ways to make you proud of your local hospital and Midland Health overall and all the work that we do. We may bring some patients on to talk about their experiences in the hospital. Sometimes that may resonate with people in a different way. We'll have maybe some physicians on. We'll bring in some service line leaders. We're going to figure this out as we go. We're also interested in feedback from you all. You can go to our website, contact us. That email goes directly to Tasa and say, "Hey, I want to hear this on the podcast." If you're watching this and you're interested in a specific topic, reach out to us and we'll find a way to cover it.
Absolutely. Well, thank you for joining us today. And thank you guys for joining us. And we look forward to seeing you in
In the
future
next
episodes.
episode.